Hi, I'm Chantel Lindsay with Brooklyn's Box, and I'm here with Dr. Anurag.
Hello.
And this is the first episode of our wonderful show that we would like to present to you guys. And we just want to get some questions to parent answers that you guys want answered. And today we're just going to learn a little bit more about our wonderful doctor and see exactly who she is and how, you guys could get to know her, and maybe one day she could be your doctor. So, what field of medicine do you practice?
I'm a pediatrician.
Mm-hmm.
I see patients from newborn through 18 usually, and sometimes up through 21.
Okay. And after 21, would you refer them out or? Mm-hmm.
So after 21, then they would have to establish with a family practice doctor or internal medicine doctor, because the issues are different, and that's kind of where my training ends.
Okay. Okay. And what drives you to serve medically vulnerable children and their families? Here.
Wow, that's a great question. I started working in a community clinic about 5 years ago. Prior to that, I was in private practice. So when I made that change, I started to notice that there were so many medically fragile children coming in, and their care was just very scattered. Things were falling through the cracks. Their health was suffering because of that, and it didn't make sense.
Yes.
It didn't make sense to me. So I started to feel like there were so many systems issues, things that could be done better to help manage these children.
Okay. And when you say things better to manage these children, can you explain to me exactly what you mean?
Because medically fragile children and their family have so many needs. They go from specialist to specialist out of town. They have therapies in town. So coming to the pediatrician is one more thing. So a lot of the time, their general care, their vaccines, their screenings, their developmental assessments, their dental, all of that just kind of gets deferred.
Yeah.
So really what I felt was needed was someone to be a voice.
Yes.
And help them deal with the various problems that they encounter,
Yes.
and take some of that load off the
Off of them,
families.
Yes. At what point did you realize this was the field you wanted to go into?
The more I did it, the more I wanted to do it, and I feel that the children and their families are truly heroic. You know, I've been meeting so many wonderful, courageous children and families like you and yours. It just kind of propelled me even further.
Yeah. Yeah. I think as parents, we kind of think the same way, because you care so much. It makes us want to learn a lot more.
Well, I mean, that should be the way it is, right?
Yes, very much so. What is the biggest difference you would like to see in your field amongst your fellow doctors?
Wow, another great question. Oftentimes, especially in private practice, but even in the community clinic realm, pediatricians or any physician, they're afraid to take on a complex case or a complex child. And I would say the biggest thing is don't be scared.
Yeah.
It's still primary care. So don't be scared to go step up and take ownership of that child and that family and to manage
Yeah.
that case in conjunction with all the specialists. But don't be afraid when you see a kid with a trach and a G-tube and a bunch of medications. It takes time,
Yeah.
but it's worth it.
Yeah.
So make that visit count and do as much as you can for that child and that family when you see them.
Yes, because if you have a happy parent and the parent is well taken care of, then they're going to take the best care of the child.
Correct.
Yes.
And you can't separate in pediatrics the child from the family,
Right.
right? The
Mhm.
child does well when you support the family
Right.
and enable the family to take care of that child. So it's a unit.
Yes. Agreed. What's one concern or burden that parents have expressed to you?
I'm amazed by the fatigue,
Yeah.
okay, the lack of knowledge of resources that are already there, and nobody's taken the time to explain that or link them to those resources.
Yes.
You know, so it's called caregiver burden, and I think families who take care of medically fragile children have a huge amount of caregiver burden.
Yes.
You know, and that affects their health and their well-being as well.
Yes. It would be nice if, along with doctors and referral specialists and nonprofits and charities, if people could work together so that resources were known on every platform,
Mm-hmm.
so that we could, an easier way
Yes.
to get people those
Yes.
services.
And that's what we do. You're part
Yes.
of that group called the MVCCP,
Yes.
Medically Vulnerable Child Coalition Project.
Mhm.
And that's where we get a chance to meet and to talk and problem solve and share knowledge and information.
Mhm.
Insurance companies, CCS, public
Public health.
health,
Mhm. Wait, Department of Human Services.
yes, foster
Mhm. Foster
families.
families.
So we do that as a group, and I feel that we help each other and support each other to support our families.
Yes, and then I know I feel like for the round table, I feel like me being a parent also
Yes.
gives that perspective, because I think sometimes when you're in the field, it's the job.
Mhm.
But when you look at it from the outside, it's like, okay, was I being fair? You know.
Right.
So I think when I come in there, I'm like, oh, okay, look at it from this way.
Yeah.
Then we start to get somewhere.
Yeah, and
Yeah.
it's a reality check for us,
Yes.
right? How we come across. So it's good. It's really good for us. We need that.
Let's see. I kind of have a last question.
Sure.
So for me, finding a pediatrician has been hard.
Mm-hmm.
What would you tell parents to do, or how would they be able to research really good pediatricians, or pediatricians that would accept kids like theirs?
So it's more of a challenge in Bakersfield.
Yeah.
There's lots of very, very good and caring physicians. I think it's more word of mouth. Like
Yeah.
if you belong to, a Facebook group or an organization for parents, you come across and make these connections. You could start by asking them, who's your pediatrician? Are you happy with them? Do they take the time to help you and to listen to you? Or do they just kind of, shove you out of the door? So I would say your peers are your best sources of reference.
That's very true.
Mhm. Or you could reach out to your public health nurse or, you
Right.
know, your social worker and see who have you worked with, who has a lot of complex patients and, you know, and reach out to them for a recommendation.
Yes, I agree. So, you guys, she'll come by and do this often, and we'll be able to answer a lot of your questions. And also, it's important for you guys to know that she is also my children's pediatrician. And I always gush about her because my Brooklyn, and some of you guys may know her because she's famous around here, has had no hospital stay in a very long time. So we're gonna knock on the wood.
Yes.
But she has been doing well, and partly because of the such good care coordination your team does, and you do. And I just think that more people just need to know about care coordination,
Yes.
caregiver burden.
Yes.
And we need to help these parents as much as they can, especially with medical conditions, because a lot of times parents just don't know about medical
Yes.
conditions. So hopefully we can answer those questions for them,
Mhm.
so that even if they're not getting it from the person that they need to get it from, at least they would have some type of access to that.
Mhm.
And we will see you guys in the next video. And thank you for tuning in. Thank you for watching. And don't forget to hit the like and don't forget to hit the subscribe. We will see you guys in the next video. Thank you for watching. Don't forget to hit that like and that subscribe. Bye.